Hi, I'm Dr. Kelly Starrett with the Ready State. And oftentimes when we're trying to get ahead of a painful situation, it can feel counterintuitive to think, wow, actually there are some really simple kind of strength and conditioning style movements that I, as a non-athletic regular person, can quickly integrate and steal from that field to make myself feel better. So typically when someone has pain, they're going to reach for whatever strategy they have, and hopefully they're starting to appreciate that H-Wave can be a really amazing tool to help get some on-demand pain relief and improve the sort of the quality of the congestion of the tissues. How do I bring more blood flow in and take the garbage out? But there are a couple things you can do also that will support that. And they're very simple versions of things we call isometrics. So an isometric is basically when I load a tissue without lots of movement happening. So if you just flexed your arm and didn't move, that'd be a form of an isometric. Or if I held that and tried to move it but wasn't able to move it, that's also an isometric. So I'm going to show you two forms of isometric. One of them is a short isometric, and one of them is a long isometric. The short isometric, believe it or not, is just going to use a common roller. This could be a couple baseballs taped together or any roller that you have lying around the house. And what I'm going to do is be thinking about putting some input into this leg, and so in this situation I've got a little knee pain, let's pretend, and what I'm going to do is, I imagine I'm laying on the ground, I'm just going to choose a tissue system that is either upstream, above, or below, downstream of the offending area. So in this case, if I had a little knee pain, what I'm going to do is go ahead and load up the tissue in the area above the knee. And all I'm going to do is roll side to side. Now, the first time you do this, you might find that you're feeling like you may be hurting yourself or torturing yourself. Pain is a normal response to compression, but it tells us that the tissues actually can be sort of experienced and maybe given some input, because the resting state of the human being is actually pain-free. So it's probably more accurate to say that this should feel comfortable and it shouldn't be uncomfortable or painful or stiff. And if I'm feeling some discomfort here, then I found something I can do to improve the movement system. So what I'm going to do is just move side to side, and if I find something that I don't like or doesn't feel good, I'm going to stop and do a short isometric. I'm going to take a big breath, and I'm going to flex the muscle into the roller. I'm just going to hold that for 5 seconds, and then I'm going to relax as I exhale and see if I can soften that tissue system. I'm going to repeat that a couple times. Big breath in, contract for 5 seconds, hold, 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 relax, and see if that starts to change. Does that start to feel less uncomfortable? And what ends up happening is that after I signal to my brain it's safe to generate force here, and I spend some time here working on breath and that isometric, I can realize that it doesn't hurt anymore, so I can start moving on. Again, moving side to side, and I'll just move up like I'm eating an ear of corn, just sort of one row at a time, scanning the area for something that potentially feels uncomfortable or is stiff. I pause, take a breath, squeeze, repeat that process. And what I'm going to do is stay on that system for about 5 minutes. And we find that that 5 minutes is a pretty decent therapeutic input. Now, in this situation, I'm pretending like I had some discomfort around the knee, but I could certainly go after my calves if it was a knee-related issue, or hamstrings if it's a knee-related issue. But the quads are usually a big offender. And what we find is that people are doing a great job beginning to manage some of the aspects of the physiology, but we want to get the brain and the movement moving, the movement part of the movement system sort of engaged. So the second thing I'm going to do is show you sort of a weight-bearing or long isometric. And basically, we're going to hold a position we know loads these tissues, and we're going to hold it for 30 seconds. I've got a couple dumbbells here, but you don't even have to have dumbbells. So imagine that my left knee is the knee that is a little irritated. I'm going to get into a big lunge position. And now this seems counterintuitive, but I'm loading some of the tissues and the musculature of this thigh with the knee behind my glute. And we call this hip extension. What I'm going to do, and feel free to balance as you need, but I'm going to come up onto my toe and bring my heel off the ground on the front leg. I'm going to shift my weight back so I'm 50-50, and I'm going to squeeze this glute as I have some weight in my hands. And then I'm going to make sure that this back foot is pointed straight. I've got all my toes down. And I'm gonna hold that for 30 seconds, taking some big breaths, keeping that glute engaged, and just putting some load in this tissue. The leg is kind of straight. We call this long lever, but I'm just holding, saying to my brain, it's safe to load this. And tissues love, and especially painful tissues, love isometrics. I'll switch, and since I'm here, I might as well do the other side. And this is a great way to load this leg as well. So now I'm loading the leg in flexion, which means the knee is bent towards the chest. And I'll just repeat that same cycle for 30 seconds, working on balance and moving and keeping that glute squeeze and trying to be 50-50. And then I'll repeat that 3 times. So I'm just gonna walk back and forth from front left leg forward to right leg forward, keeping the glute squeeze, feet going straight, and trying to hold that for 30 seconds. When we begin to take a systems approach, we understand that the H-wave is really a movement tool that allows us to quickly get some desensitization and to decongest that tissue. That allows us now the opportunity to go ahead and load the system. And that loading can be done easily with just a little short isometric on a foam roller, or a long isometric holding an athletic style position or a shape that looks like human movement, in this situation, walking. You'll find is that when we put all of these systems together, we have as a brain and a body that responds in kind, we start to feel better and want to move better.